Hello, my name is Sheila Bauer, and this is my head-to-toe assessment for Advanced Health Assessment for Marietville University. This is my patient, Kelly. I've already done a general inspection of Kelly. I've asked her to empty her bladder and put on a gown. I've taken her vital signs. Her vital signs are blood pressure 110/60, pulse is 70, 98% on room air, 98.1 is her temperature. I've taken her height and weight. She's 130 pounds and 5'5", which makes her BMI 21.6, which puts her in the normal range for BMI. We've done her distant vision with the Snellen eye chart. She's 20/20. We've done her near vision with the Rosenbaum eye chart. So first, I'm going to start with head and neck. Okay, Kelly, first I'm going to just start with a general inspection. I can see that her skin is nice and pink, intact. There's no abrasions noted. Her skull is normal cephalic. I see symmetry placement of her eyes and ears. Now I'm going to palpate your scalp. The hair is evenly distributed. There's no alopecia. I don't feel any tenderness or masses when I palpate it. I'm going to palpate your facial bones. Again, no masses, tenderness noted. Next, I'm going to do your TMJ. So I'm going to have you open your mouth, move side to side. Okay, no popping or clicking of that. I'm going to palpate your sinuses, frontal and your maxillary. Any tenderness at all? Okay, no tenderness in our sinuses. Next, I'm going to move on to do some cranial nerve assessments. So Kelly, I'm going to have you clench your teeth, squeeze your eyes shut, wrinkle your forehead. Okay, smile, puff out your cheeks, move your tongue, stick out your tongue, move it side to side. Okay, the cranial nerve assessment is intact. I've looked for symmetry. There was symmetry throughout. So now I'm going to do the light sensation test. So Kelly, I'm just going to have you close your eyes and tell me if you feel this cotton ball, one or both sides, and where. Both, soft, forehead, cheeks, both, chin, both. Okay, perfect. Okay, I'm also going to do another sensation test. You'll have to close your eyes and tell me what you feel is sharp or dull. Sharp, dull, dull, sharp, dull, dull. Okay, that is also intact. Perfect. Now we're going to move on to your eyes. First, I'm going to start with an inspection. I can see that her the placement is good. She's symmetrical. I can see that her eyebrows are bilaterally, the hair is evenly distributed, her eyelashes extend outward from her eyes. I don't see any redness, tearing, no swelling. I'm going to palpate your eyes now. If you close your eyes, the lateral apparatus, as I palpated, I notice it's negative for any tearing or exudate. We'll palpate her eyelids. Okay, no swelling noted. Her sclera white, her conjunctiva, nice and pink. Now we're going to check pupillary response. Okay, so just look straight ahead. Okay, pupils equal round reacted to light, and they are at 4 and 3. All right, next we're going to do the cover uncover test. So Kelly, I'm going to have you close one eye, cover one eye. Okay, focus on this, my finger. All right, cover the other eye. Focus on my finger. Great. So what I was looking for was any strabismus or eye movement, and I did not see any. Next, I'm going to do the red reflex. So I'm just going to have you look straight ahead, Kelly. Let's go. Okay. Red reflex is intact bilaterally. All right, and now I'm going to test for your extraocular eye movements. So it's going to be 6 cardinal fields of vision, and what I'm looking for is cranial nerve 3, 4, and 6. So Kelly, just follow my finger. Perfect. I did not see any extraocular eye movements while doing that. So cranial nerves 3, 4, and 6 are intact. So now we're going to move on to your ears. First, I'm going to just look at the alignment and placement. The alignment of the auricles is within the inner canthus of the eyes. They are symmetrical. They are not low set. They're nice and pink and intact. I don't see any swelling or nodules in the outer ear. We'll next palpate your auricles. Okay, they are firm but movable. No tenderness noted upon palpation. Now I'm going to look in your inner ear. And I'm going to pull the ear up and back. I can see that the tympanic membrane is nice and pearly gray. The light reflex is intact. No redness, swelling, minimal earwax. Let me look in the next one. Again, up and back. I can see the tympanic membrane. There's no perforations. Nice and pearly gray. No swelling, redness, drainage. Again, minimal earwax. Next, I'm going to do the whisper test. So Kelly will have you cover this ear, and I will say a word, and stand about 5 to 6 feet behind you, and you tell me what that word is. Apple. Okay, great. Now I'm going to go on the other side. Orange. Okay, perfect. Next, I'm going to do the Weber test. So I'm going to strike the tuning fork, place it in the middle of your head, and you're going to tell me if you hear it on both sides or one side more. Okay. Both. Okay. Now we're going to do bone versus air conduction. Again, I'm going to put this, strike the tuning fork, put on your mastoid bone, tell me when you stop hearing the sound, and then I'm going to put it right outside your ear, and you tell me when you stop hearing the sound. Okay. On your mastoid bone. Stop. Okay. Stop. Okay. Air conduction is twice as long as bone conduction, so I will do it on the other ear. Stop. Stop. Okay. So that's what we expected for bone versus our air to be longer than bone. Now I'm going to move on to your nose. First, I'm going to inspect it. It's symmetrical, skin's nice, dry, intact, and pink. I don't see any bumps or nodules. Okay, tilt your head a little bit. I'm going to look at your septum. I can see that there is no perforations in that septum. It's nice and pink. It is also midline. I'm going to check nasal patency, so cover one side of your nose and blow. Okay, other side. So both sides of our nose are patent bilaterally. Okay, I'm going to also look in your nose. So tilt your head up again. All right, I can see the turbinates. It's nice and pink and moist. No swelling, no edema. It looks great. All right. So now we're going to move on to the mouth and pharynx. First, I'm going to inspect Kelly's mouth. I see their lips are nice and pink and moist. There's no cyanosis, no cracking. I'm going to have you open your mouth and we'll look in there. Grab my tongue depressor. Okay. All right. I can see in your mouth, her hard palate, soft palate, nice and pink, intact, no perforations, no swelling. Her gums are nice and pink. There's no redness, swelling, bleeding. Okay, I can see that her uvula is midline. I don't know any mouth odor. Let me look at her teeth. Her teeth are nice and pearly white, approximately 32. Open. There's minimal wear, just a couple cavities. It looks like they've been filled, but very good overall health. Okay, I'm going to look at your pharynx. So posterior pharynx, nice and intact. Your buccal mucosa, nice and pink. I can see that your tonsils, they're average size. There's no swelling of those. Anterior pillars are glistening pink, nice and intact. Uvula midline. You stick out your tongue. Okay, I see that her tongue is like a dull red in color. The texture is a little bit rough. I'm going to look at the lateral sides. Oh, lift up your tongue. Dorsal sides under the tongue. Sometimes this can be a common site for oral cancer, but I don't see any spots, abrasions. Tongue is nice and pink and moist. No issues there. Okay, so next we're going to check your gag reflex and your say ah reflex. So I'm going to say ah. Okay, I can see that the soft palate rose and her uvula stayed midline. Okay, I'm going to check your gag reflex. I'm going to stick this back here. Okay, gag reflex is also intact. Thank you, Kelly. Okay, now we're going to move on to the neck. So first, I'm just going to inspect her neck. This includes thyroid, and any kind of trachea. I don't see any obvious jugular vein distension. I don't see any obvious swelling or edema. Her skin is nice and pink and intact. No abrasions noted. I'll next palpate her neck. So I'll do one carotid pulse at a time. Okay, the rate is regular. Rhythm is +2 on the pulses. I'll feel your trachea. The trachea position is midline. I don't feel any no tenderness, no nodules. Next, I'll palpate your trachea. Nice and smooth, no firm, unmovable nodules noted upon palpation. Okay, so next we're going to do range of motion. So what I'm going to do, Kelly, is put your head front and back. Okay. Shoulder side to side. Shoulder, and then put your shoulders, shrug them up. Okay. Now try to put your head up and back again. Okay. Side to side. Shoulder shrug. Okay. Great active and passive range of motion. So next, I'm going to palpate Kelly's lymph nodes. So we have our preauricle, postauricle, occipital, tonsillar, submandibular, submental, the superficial cervical chain, the posterior cervical chain. There's the deep ones. Move your neck side to side like that. Okay, perfect. Okay, the supraclavicular. I could not palpate those. You're normally not supposed to palpate a supraclavicular node unless there's some abnormality, so it's great that I couldn't feel it. The infraclavicular, and then comes up the axillary. Okay, upon palpation, I noticed that each were less than 1 centimeter. They were not firm, not tender. They were all movable, so these are all great signs. Lastly, for the neck, I'm going to auscultate with the bell on my stethoscope Kelly's thyroid and carotid. Okay, take a deep breath and hold. Great. No bruise noted upon listening to that with the bell of my stethoscope. Next, we're going to move on to Kelly's back and posterior chest. So, I'll have you. Yeah. So first, I'm just going to inspect it. Skin is nice and pink and intact. I don't see any masses or nodule. A little bit of ecchymosis or bruising right here. Kelly had said she had fell down the steps earlier this week. Everything looks symmetrical, as I can see that she's not having any labored breathing or anything. I look at her thoracic configuration. I see that the AP diameter is less than the lateral. No barrel truss. It's a 1-to-2 ratio. I'm going to palpate and percuss Kelly's costal vertebral angle. Lightly palpate. Mrs. Bruise. Any tenderness there? No. Okay. No tenderness with that costal vertebral angle. All right. So Kelly, I'll have you stay there, and I'm going to inspect her lungs with her posterior chest. So again, I can see that her breathing is symmetrical, rise and fall of her chest. No intercostal retractions from this. Skin is nice and pink. Next, I'm going to palpate Kelly's diaphragm here. So I'm going to place my thumbs about at the 10th intercostal space. Take a deep breath. Okay. So with that, my thumbs diverge equally, symmetrical, rise and fall. Now we'll do tactile firmitus. Say 99, 99, 99, 99, 99, 99, 99. Okay. I'm going to move to your anterior chest and do tactile firmitus as well. 99, 99, 99. Okay. And I'm also going to do excursion. So take a deep breath. Okay. So my thumbs diverge equally and symmetrical with the rise and fall of her breathing. And next I'm going to percuss Kelly's posterior and lateral chest. What I'm going to be looking for is resonance. Hyperresonance might indicate air or fluid-filled lungs. So in a systematic way, I will percuss. Okay, so I heard resonance throughout, which is what I expect. Next, I'm going to do diaphragmatic excursion. So what I'm going to do is have Kelly take a deep breath and hold it. And I'm going to palpate or percuss until I hear resonance to dullness. So I'll cuss that. I'm going to get my pen to mark. Okay. So Kelly, take a deep breath and hold. It's on the scapular line. And mark that when I heard the dullness. Okay, breathe. And now I'm going to go until I hear dullness or resonance. Oh, I'm sorry. Kelly, take a deep breath and then blow it out. And then hold. Thank you so much. Okay. So then I'm going to measure that. Normal diaphragmatic excursion is 3 to 5 centimeters. And I got about 4 on Kelly, so that is just what I expected. I would also do this on the other side. All right. So next I'm going to auscultate the posterior chest. And what I'm going to do is just compare side to side to see if there's a difference. So Kelly, just... Okay, I'm also going to listen to her anterior chest. Oh, that's okay. Okay, so breath sounds or vesicular breath sounds, they were equal clear, no wheezes, no rhonchi noted. Okay, Kelly. So next, I'm going to have you turn around and we will do your anterior chest. Thank you, Kelly. Okay, I'll put this gown down a little. First, I'm just going to go through inspection. I can see the symmetrical rise and fall of her chest. Skin is nice and pink and intact. I don't see any masses or nodules. Unlabored breathing. Again, symmetrical rise and fall. No intercostal retractions noted. I don't see any thrills or pulsations noted as I do that. No heaving. Next, I'm going to palpate Kelly's chest wall. So I don't notice any tenderness, no masses, no nodules. I don't feel those pulsations or heaves or thrills. I'm going to palpate Kelly's apical impulse, which is about the 5th intercostal space, midclavicular line. Okay, great job. So after that, I'm going to percuss in a systematic way. Again, we're looking for resonance. So systematically, I percuss Kelly's chest. Okay, so resonance was heard throughout in a systematic way. So lastly, I'm going to auscultate. I've already auscultated Kelly's lung sounds. They were nice and clear and equal. Now I'm going to do heart sounds. So there are 5 that I will listen to. 5 areas. So we have the aortic, the pulmonic, the Erb's point, okay, tricuspid, and mitral. And I'll also listen with the bell on my stethoscope. Okay, I heard S1, S2, regular rate and rhythm, no murmurs, no rubs. So that sounded great. So next we're going to inspect your abdomen. So I'll have you lay down, Kelly. So upon inspection, I note symmetrical, the contour is nice and flat, slightly rounded. I don't see any masses or nodules. Skin is nice and pink and intact. A couple nevi and freckles noted. There's no pulsations and no peristalsis noted. All right, next I'm going to auscultate. So there's 4 areas that I'll listen to vowel sounds. So start in the right lower quadrant, move to the right upper quadrant, left upper quadrant, and then left lower quadrant. I'm going to listen no more than 2 minutes, noting tone and frequency of vowel sounds. She had positive regular vowel sounds in all 4 quadrants. Next, I'm going to auscultate Kelly's abdomen with the bell of my stethoscope. I'm going to do the aorta, the renal right and left, the iliac, and the femoral. Okay, no bruits noted. Very good. Next, we're going to percuss. So the tone that I'm looking for, tympany over airfield, and dullness over the solid filled. So I'm going to do liver border. So I'm going to start kind of at the midclavicular line and listen for tympany to dullness, and then mark that. Mark it. Then again. Mark it, and then we'll measure it. So normal liver border is 6 to 12 centimeters. Kelly's is about 6, which is expected. So now I'm going to percuss for splenic dullness. Again, dullness is heard over the more solid organs. Next, I'm going to do palpation. We'll start with a light palpation. No tenderness, Kelly. No masses, no tenderness noted. And then you go into a deep palpation. All right. So I can feel the liver border, roughly 1 centimeter below midclavicular line. It's nice and smooth and non-tender. We'll try to palpate for the spleen. I do not feel the spleen, and that is normal because spleens are not usually palpated unless they are enlarged. Okay. And next, I'm going to palpate the kidneys. So we got the right and left. Okay. And then midline for aortic pulsations. Okay, Kelly, I'm going to have you slightly come up here, and I'm going to look at the muscle and tone of her abdomen. Again, there's no pulsations, no tenderness noted, no masses, nodules. Great job, Kelly. You can sit up. Lastly, we'll move to Kelly's upper and lower extremities. First, I'm going to inspect Kelly's arms, hands, and shoulders. I can see that the skin is nice and pink and intact. The length and muscle mass is even. There's no tenderness upon palpation. The temperature is nice and even throughout, does not get cooler distally, no edema. Look at her nail beds. They're nice and clean and pink. No clubbing. Capillary refill is less than 3 seconds. I'm going to feel Kelly's brachial radial pulse. Brachial. All right. Here's her radial. Okay. They're nice and regular rate, even. I'm going to do Kelly's brachial reflex. So, just kind of relax your arm here, Kelly. Okay, that is intact, and I would also do that on the other side. Now I'm going to check for range of motion. So Kelly, just going to have you put your arms out, then move them. Okay, good range of motion. So cross your hands like this. Okay, now pull, push against me. Okay, now squeeze my hands. Okay, muscle strength is great as well. So lastly, I'm going to look at Kelly's lower extremities. Again, I can see that the length is even, muscle mass is evenly distributed, skin is nice and clean, dry and intact, a little bit more ecchymosis, the bruising, a couple freckles and nevi, no masses and tenderness upon palpation, no edema, the temperature is warm throughout, does not get cooler distally. I'm looking at her nail beds of her toes, they're nice and clean and pink. Cap refill is less than 3 seconds, no clubbing noted. So now we're going to move on to pulses. So I'll feel Kelly's popliteal pulse, dorsalis pedis, and then our posterior tibial. Okay, so regular rate and rhythm, and they were also +2. So lastly, we're going to do some reflexes. So I'm going to have you come up here, scoot to the edge of our table. Move this down a little bit. We'll do Kelly's popliteal reflex. Okay, just relax that. Okay, great. And then her Achilles tendon reflex. Again, just relax this leg. And I would do that bilaterally on both sides as well. So as I watched Kelly walk into the examination, I noted that her gait was even, no issues there. We'll do muscle strength. So Kelly, I'll have you push against my hands. Okay, pull up. Muscle strength is good there. Okay. And as she walked in before the exam, I also noted that she was alert and oriented ×3. Lastly, we'll look at Kelly's cervical and lumbar spine. So Kelly, I'll have you bend over. Okay. I can see that everything is symmetrical, no masses. Okay, stand up. Okay, so I'll have you twist at your trunk. Kind of bend side to side. Okay, great. Good movement of her lumbar and cervical spine. Okay, this concludes my examination. Thank you so much, Kelly. You were a great patient.
Thank you.